So Ebola is both the name of a virus as well as the name of a disease caused by that virus. The name Ebola itself actually came from a small river in the country formerly known as Zaire, which is now the Democratic Republic of the Congo. That was the place where the first Ebola infection was ever detected. The most common way to get Ebola is to get exposed to body fluids from someone who's previously been infected. And the most efficient way for that virus to enter into us is to come into our own mucosal tissues. In other words, if it comes in through your nose or through your mouth, or if you get exposed to the eye, any place where you have these so-called mucous membranes, that's where you get exposed to Ebola most frequently, if someone has that. Now, with that said, if you have an open cut on your hand and you get exposed to someone's blood, that's another way to get infected. But we tend to, commonly we don't have cuts, open cuts or sores. And so it's thought that exposure to the mucous membranes is the most effective way. Sexual transmission of Ebola has also been shown to occur because we have mucous membranes that are associated with sexual activity as well. One of the first symptoms is people start to develop a fever. And of course, that's not specific to Ebola. That could happen with lots of different types of infections. Other symptoms you start to develop are muscle aches and pains, headache. You can also develop, malaise, so people vomit or have diarrhea. Those are some of the symptoms that aren't very specific to Ebola at all. So clinicians would only have any idea that you have Ebola if you tell them that you've actually traveled to a place where Ebola normally exists, in West Africa and in Central Africa. The most specific symptom that people start to show, which really indicates that Ebola may be in play, is to have internal bleeding. So you can have bloody stool, you can have bloody vomit. If you get an abrasion on yourself, or if you get hit by something, then you can see the bleeding happening under the skin. And this is not something you would normally see if someone just was struck with something or tripped or fell. So if you see this hemorrhaging, this bleeding under the skin, that's a good indicator that Ebola might be the cause of your other non-specific symptoms like the fever. So the very first instances of people being infected by Ebola and by another cousin virus called Marburg virus were instances in Central Africa. These most recent outbreaks are happening in West Africa, and that's what makes it so interesting, is that the virus hadn't been ever shown to infect people in West Africa up to this point, up to this recent outbreak that just started this year. Now, we believe that fruit bats are the organism that we normally find the virus replicating. And the bats, as far as we can tell, don't get sick from the virus. They're what we call a natural host. But when we look at the natural range of where these bats live, it expands from Central Africa, where we've seen the virus, for over 40 years. And they actually also have normal habitat in West Africa too. And so that actually is greater evidence that those animals are really the ones that actually harbor Ebola viruses, is because they actually expand, to cover the original range and also this new range where we hadn't seen the virus previously. The only other place where we've ever seen Ebola viruses before is actually in the Philippines. There's a different type of Ebola found there that can kill monkeys, but when humans have been exposed to that virus just a few times ever, those humans did not develop any type of disease at all. But they did get infected because they made antibodies against the virus. And that's actually the subject of a book called The Hot Zone. It talks about Americans that were doing primate research in Reston, Virginia, actually got exposed to that Ebola from the Philippines and got infected and thought they were going to die, but fortunately they didn't even get sick. One thing we have to remember about Ebola is it is still a very rare virus to contract in humans. It's a very rare disease. The reason why I mention this is we have over 30 million people around the world who are infected with HIV, and many of them are developing AIDS. And every day we lose about 4,400 AIDS patients who die from AIDS every day. The total number of people that have ever died of Ebola, as far as we know, where we've actually diagnosed them to have Ebola, is only 7,000 to 8,000 people ever. So that's only about 2 days worth of people dying of AIDS. And we have about 250,000 to 500,000 people that die of influenza every year. And in most cases, they're not getting the vaccine, or they don't have access to get the vaccine. So this is a relatively small player, but it's getting a lot of publicity right now because when people die of Ebola, in most cases they're dying because they're bleeding all over. They're bleeding from the eyes and the mouth, and they have bloody stools and everything. And so it's just a terrible way to die. But in reality, we're kind of blowing all of this out of proportion. It's not very transmissible from human to human.